Hi, I'm Colleen from Revive Ear Seeds and Acupuncture. I'm here today to talk to you about the difference between auriculotherapy and acupuncture, which also this video could be called, What the heck do you do? And is there a difference between these things? So the short answer is yes, it's auriculotherapy. I practice auriculotherapy. And yes, there is a difference between acupuncture and auriculotherapy. So most people kind of know what acupuncture is at this point. It's using acupuncture needles in certain spots on the body for health benefits. And there's other techniques used in acupuncture as well besides needles. You know, maybe you've had cupping or gua sha or taken an herbal preparation. That all falls within the realm of acupuncture. And acupuncturists do work with the ear and use needles on the ear and use ear seeds as well, which is something I do too. Auriculotherapy is stimulating the points on the ear specifically, like just working with the ear, almost like reflexology. And the feet is a map of our whole body. The ear is also a map of the whole body. And depending on where you are stimulating, it has an effect on a certain area of the body. But they are independent modalities, acupuncture and auriculotherapy, even though acupuncturists do learn some auriculotherapy in acupuncture school, and they may practice that as part of their practice, like putting some ear seeds on or putting some needles in the ears. But auriculotherapy on its own is a standalone modality and can be used to treat a variety of things. And it doesn't have to just be acupuncture needles that we use in auriculotherapy to stimulate the ear. You can use ear seeds, you can use an electrical stimulation device, you can use something like this is my light wand. So this uses LED and infrared light. When this is turned on, it comes out of the tip there, and you hold it over the points and it stimulates the points that way. You can use your fingers, your hands to massage your ears. So regardless of what tool you're using, that's all auriculotherapy because we're working on those points on the ears. My favorite ways to work on the ears are with acupuncture needles, with ear seeds, and with the light wand. So those are the main three that I use. And I am a licensed acupuncturist in the state of New York. I maintain my acupuncture license so that I can practice auriculotherapy. I can use ear seeds and I can use the needles and work on people's ears professionally, like as in take money payment for my services. And that's within my scope of practice as an acupuncturist. And I'm covered under like liability insurance because I maintain that licensure. So that may vary state to state who's allowed to do this. But I do like to use needles, so I do maintain that acupuncture license. And I do this professionally. So, but the big difference of why it's a different modality, or it's like not exactly the same as acupuncture, even when I'm using a needle, is because in auriculotherapy, I don't use a Chinese medicine diagnosis. If you went to an acupuncturist, you might have answered a lot of questions. They ask you a lot of questions about what's going on with you. They take your tongue and pulse, or look at your tongue, take your pulse on your wrists, and that's all them gathering information to do what we call like a Chinese medicine diagnosis. It kind of helps determine what's the root cause of what's going on with you, and then that determines what points on the body you would use or what methods of treatment they would use. For auriculotherapy, that is all not really necessary. So we're just working with the ear, and while there may be, for example, if someone comes in with back pain, if you see an acupuncturist, there may be like um, multiple Chinese medicine diagnoses for back pain, which would all have their own individual like treatment plan and set of points and things that you would do differently based on, what they determine through asking you those questions and looking at your tongue and taking your pulse. For auriculotherapy, it's just like a little more straightforward. If that same person comes in with back pain, there's a spot for back pain on the ear. You do the back pain point. You do the point where the back is. You do pain points, and it's not necessary to have that Chinese medicine diagnosis. Sometimes for me, because I am an acupuncturist, I may like incorporate some additional knowledge into my point selection on the ear, but usually it's just it's not something that has that I have to like take into consideration. Um, but that's the main difference. So I typically tell people that I practice auriculotherapy. If I'm going to be using needles, I'll call it acupuncture because just the general knowledge and the public knowledge, um, people know when you're going for acupuncture, there's going to be a needle. So it just makes it a little easier when I'm like, advertising for any event or letting someone know what I'm doing. If I'm doing ear seeding, I'll say ear seeding. And when I'm in person, I do try to introduce that term auriculotherapy and let people know what that is. And that's like really what this modality is. No matter if you're seeing me for acupuncture or ear seeding, we're working with the same points. I'm just using a different tool to stimulate those same points. So that's what I really wanted to get across in this video, because I do feel like people ask me that question often if they come to me for acupuncture. And I do try to specify in my advertising too that it's ear acupuncture or auricular acupuncture, so they kind of know what to expect, that it's maybe not your typical acupuncture treatment. But people that would see me for acupuncture and I tell them about, hey, maybe you want to try ear seeding another time, and they want to know the difference. And it's really, we're doing the same points. It's just another method of stimulation, and that this is its own modality. So auriculotherapy really was developed in France in the 1950s by a medical doctor named Dr. Paul Noget. So it's although it was embraced by China, and China really, the acupuncturists there and the acupuncture world really like embraced it and kind of like incorporated it into what they do. It is more of a Western modality, and that's just kind of where it comes from. Maybe that's another video. We can talk more about that, the origins of it, where it comes from. But I just wanted to let you know kind of how I use these terms and what I mean when I'm working on somebody. To me, it's all auriculotherapy because I'm only working with the ear. But I'll call it acupuncture when I'm using needles, just so the client knows we're using needles. But yeah, so that's what I have for you today. And I hope that makes it a little clearer for you, like, what the heck are you doing? So yeah, all right, take care.